Alright guys, this is the second lecture in the Electronic Health Records book. And today we're going to be talking about the overview of SimChart for the medical office. Now SimChart is our version of medical simulation software. In here we'll get into talking about everything that we can really do with this. Now it's a brief overview. It's really important that you dive more into the materials with your chapter review exercises and looking over the book as well, as I can't cover everything through these lectures that needs to be covered in the book. So some of the things that we're going to talk about today, we're going to describe the medical assistant's role in promoting electronic health records. We're actually going to log into the SimChart to the medical office for the first time, and we're going to play around with it a little bit there. We need to find and use the student resources available to us in SimChart to the medical office. We need to understand how to view and submit assignments in SimChart to the medical office, access the SimChart Simulation Playground, which is what we do all of our assignments through, and navigate across the modules. We need to identify common buttons and other reoccurring elements in the SimCharts that you'll see all the time, okay? And we need to explain the difference between active and closed records, and then discuss how to create new patient records in the SimChart for the medical office, as that is going to be part of your assignment for this section. And then we'll also discuss the appropriate use of the internet in not only the physician's office, but in this trade as well. So it's really important, guys. That's a big hot topic here. So the medical assistant and electronic health record promotion. So when you're going through this, all I want you to think about is what type of office do you want to work in? Do you want to work in a pediatric clinic? Do you want to work in a geriatric clinic? Do you want to work in orthopedics or gynecology or anything like that? So really try to focus on your studies, okay? What are you really trying to gear your studies towards? So as medical assistants, continue to stand at the forefront of to the digital transition to electronic health records. So medical assistants skilled in electronic health records are extremely marketable. Okay, you can go to any office, any hospital, and be able to use their systems. So having the skill training in this is essential, guys. And SimCharts in the medical office will help gain exposure to those and master those items and skills that is needed in EHR systems. So I know it's really hard to see in here, but this is the student page for on Evolve to get into SimCharts for the medical office, okay? So SimCharts for the medical office has a number of resources to help get you the most out of your system. You can access these from the Evolve page, which you see right here. The link is for student resources is down under the course content on your login portal. And listed, you can get in there and there's a bunch of files and papers that you can get on and look and use to your advantage as well. So really take advantage of those, guys. So this is SimChart for the medical office assignment view. So when you first log into SimChart for the medical office, it will bring you to this page. There will be assignments listed down there. The one that I really want you to focus on is this Simulation Playground button right there. On your SimCharts, guys, it is an orange button right in the right-hand side, and that is what we are going to be doing all of our assignments on, and that's where we're going to just get on and play around with it a little bit. So when you enter SimCharts, the medical office, from the Evolve portal, you'll be directed to this page. From this page, you can access the Ehr Simulation Playground, which I just explained to you, and which is really essential because that's the only way we get in and do our assignments. So that Simulation Playground is a practice environment that allows you to explore a fully functioning electronic health record and familiarize yourself with the features and workflows available. So really take advantage of this, guys. Really try to learn the process, okay? I will give you step-by-step instructions to help guide you through these assessments, but as we continue to go on and you get more proficient and efficient in SimCharts in the medical office, it's really important that you be able to do these things without going by the step-by-step workflows. Now there are many different modules so SimCharts in the medical office is organized into 3 modules established to simulate the medical office workflow. So the following patient visit from start to finish. All right, you're taking the patient in, you're processing them, maybe you're adding them in and creating a new patient file, all the way through their visit throughout and the reimbursement phase as well. So keep this workflow in mind. SimChart for the medical office is organized into front office, as you can see here, front office, clinical care, and then coding and billing. Okay, the first thing we're going to talk about is the front office, which is really what we do. Okay, but we need to be familiar and be able to access and edit any part of the the SimCharts. So some of the tools that are available in the front office. So users can create, edit, and delete new or established patient appointments. So here you see our calendar view. You can get on, open those up. You can delete them, you can cancel them, you can create new ones. It's really your scheduling book. An appointment matrix can be established by adding blocks or other appointment slots such as staff meetings, lunch hours, or sales meetings so that we don't schedule any patients within those time periods. Other administrative functions within the front office module include composing patient letters, phone messages, and emails with the use of the correspondence menu, which is right here. So you get on there and it opens up a bunch of different templates that you would need to use for the front office administration. The patient demographics tool right here is used to establish and manage patient and payer information, and the form repository right there, the farthest one on the right, provides a comprehensive set of office forms, everything from advanced directives to notice of privacy practice, patient bill of rights, to like clearance to return back to work or school. So there's really all of those there. It's really good to play around and see those. Then there's the clinical care module. So in the clinical care module, you can do many different things. View and document all patient care within the clinical care module, accessed by clicking either the clinical care tab right here or the find a patient icon right there, and it will both bring you to the clinical care module. So once a patient is selected, SimCharts for the medical office will display a summary of the patient, all patient record entries, as you can see here. Okay, this is known as the patient dashboard, and it's really important to familiarize yourself with this, guys. So in addition to clinical functions, the user can upload diagnostic and lab results with the help of the form repository in the front office module, which is still you can still access from the clinical care module. So there's a bunch of different things here, guys. You can update progress notes, you can edit vitals and document their problem list. So it's really important to be able to document these encounters with the physician and what exactly happened there, so that when you continue on in this workflow process of your medical office, it all flows together nice and easily. And then third module is the billing and coding, or coding and billing module. So managing the monies going in and out of the office is the primary responsibility of the billing and coding department, and the focus of the last SimChart in the medical office module. So the main features of the billing and coding module include super bills. They're also known as encounter forms, patient ledgers, claim processing, as well as the day sheet. So just like the front office and the clinical care, the form repository plays a large role in this module as well. Insurance specialists regularly use forms such as insurance claim tracer, patient statements, and bank deposit slips. So it's really important to be able to use those form repositories, fill out those templates, and make the most out of that form repository system. So there are many reoccurring features in SimChart for the medical office. Many SimChart for the medical office functions are content specific, meaning that the tools and buttons available are specific to the task being performed. Now remember, those are called buttons. We have checkboxes and radio buttons. There is a difference. Checkboxes are used when you can select multiple things at once, while radio buttons limit your choice to one single answer. Default settings and info panels. You have structured and unstructured data entry. Structured could be like a drop-down menu where you click and enter your thing. Unstructured is where you would type in a description about something. And then you have the find a patient tool, which you get in and it'll pull up their patient demographic sheet and bring you to that patient dashboard. So here's the find a patient tool. This is something that you guys will use all the time, and no matter what it's called in your medical office, this will be very important. So the find a patient tool makes the task of finding a particular patient painless. When you type in the first few letters of the patient's last name in the last name field and click the go button, the EHR automatically displays matching items at the top of the list, making your search for patient records so much easier than going to a records room and trying to pull out a paper file. So establishing and maintaining a patient registry. So the first thing that you need to be aware of is the retention period. Now the retention period is the amount of time that you have to retain these files by state law, okay? If you look on page 43 in the textbook, you'll see table 2.1, and it shows the recommended retention time for paper files. So then we have active patient versus closed patient files. Now an active patient is somebody who has been seen within the clinic within the last 6 months. Okay, inactive patients are longer than that, are longer than 6 months, okay? And a closed patient is somebody who is no longer being seen at your practice. Either they moved away, they found a new provider, or they have died, okay? So one of the things that you're going to have to do in this new assignment, in your assignment for Chapter 2, is entering new patients into the SimCharts. So from the Simulation Playground, which we are all going to play around with, click the patient demographics icon. From there, perform a patient search first, and then click Add a Patient. The patient demographics is organized into 3 different categories. You have the patient, the guarantor, and the insurance tabs. Now, it's important that your patient information sheets that you hand out to your patient to fill out has all the information that you will need to fill in these tabs. So if you look on page 44 to 47 on your textbooks, you can follow the detailed steps on how to enter in new patients, and you can play around with that and just see what exactly that consists of. You will be doing this for your assignments. And then in closing, the internet use in the medical office. Okay, so there are many different uses the reasons why you need to use the internet in the medical office. It could be for patient education directions. Maybe you have to print off some sheets for the patient if they have, I don't know, say diabetes, and how you can educate the patient in order to handle that diagnosis, and then as well as community resources. Maybe you're trying to send them to a Salvation Army or Alcoholics Anonymous or something like that. You can print those things off and give the patient's community resources to better their visit as well. So some examples for professional uses in the medical office could include members of the healthcare team may use it to locate testing centers for patients, identify appropriate clinical trials, find links to community support groups, and print patient education material. So it is a necessary tool for all SimChart for the medical office access. However, you need to avoid these personal uses in the workplace setting, okay, as well as in the classroom. Okay, so avoid blogs, social media, Facebook, YouTube, anything like that, Craigslist, okay, and the personal email accounts during work. Okay, work time is dedicated to your job, not to your personal life and what is going on there. Now, if your office policy states that you can use the internet service to answer personal emails and those types of things on your breaks, okay, that is another story. However, in this setting, you should avoid personal uses at all times. And that is it for this chapter, guys. So it's really a brief overview, just getting you introduced into the SimChart world. As you go through the electronic health record portion of the course, you will get a lot more in depth. You'll be able to manage a lot more different things here, and we'll break up those modules a lot more and get into different things here. As far as this chapter, that's all I have for you. Make sure you get your chapter reviews in. Those are extremely important in understanding the content of the chapter, as well as your assignments, which works on the workflows. So if you have any questions, please feel free to come up and ask me. As I said, the lectures are great tools, but really dive into the content and try to understand as much as you can. Have fun and good luck with your studies, guys.